Well, summer is in full swing, and with that, many of us can't help but think about travel. Except, of course, in a pandemic, it's a bit complicated. We're all eager to escape our bubbles, but there are major risks involved, and perhaps the biggest travel conundrum of all, the United States. All the way back in March, the Canada-US border closed to non-essential travel. And every 30 days for the past 4 months, the two countries have agreed to keep that border closed. Poll after poll has suggested Canadians are happy with that decision, but the border won't stay closed forever. And so the question we are asking tonight, what happens when it reopens? Joining me now to help answer that, two infectious diseases specialists, Dr. Isaac Bogosh, who we saw earlier in the program, and Dr. Rewat Deonandan. Hello to the two of you. So, Dr. Deonandan, maybe I'll just start with you so that we're all on the same page. I mean, it's easy to skim through media coverage in the United States and think, oh my gosh, things are really out of control. But give me that sober assessment of how Canada and the US compare.
Well, we like to think of our two countries as being very similar. We have similar demographics, similar language, similar entertainment tastes. But pandemics have a way of revealing the truth of a society, the frailties and the strengths. What this pandemic has revealed of the United States is a fractured society. Now, it's difficult to describe one nation in aggregate when it's so diverse, 50 different states with 50 different experiences. But we're seeing ideological splits, we're seeing tribalism, we're seeing distrust of authority, we're seeing the rampant rolling through society of pseudoscience. In Canada, on the other hand, for the most part, we've seen a unified vision. We've seen most Canadians lining up behind our leaders. We've seen people willing to sacrifice for the betterment of the society. So this pandemic has really, for me, delineated a cultural difference between the two countries around how we're willing to behave to keep each other safe.
Right.
And in the United States, that's gone poorly.
And I take your point that we're talking about two very diverse countries here, so it's hard to sort of brand either one in a sort of a singular way. But Dr. Bogosh, when you look at the numbers, I mean, is the pandemic in the United States sort of clearly and measurably worse than in Canada?
Oh, absolutely, and basically by all outcomes. Even if we just look at the sheer number of cases in the United States, they have somewhere between 70 to 75,000 new cases per day. We have individual states like Florida with anywhere from about 10 to 15,000 new cases per day. And when we think about Canada as a country, in general, we're getting between 200 to 400 new cases today from coast to coast. So Canada has done a much, much, much better job getting their epidemic under control compared to the United States. Ours is rather controlled right now. Of course, we're seeing little outbreaks here and there, but in the United States, it's still a raging forest fire.
So then, Dr. Bogosh, I mean, what's at stake here? I mean, if the U.S.-Canada border were to reopen, I don't know, say tomorrow, what would the health consequences be of that?
Oh, it would be a disaster. I mean, we would certainly risk importing infections across this border. And this is, we have a huge land border. And of course, in pre-COVID-19 times, there was a tremendous amount of travel across that border, both with Canadians traveling to the United States and Americans coming to Canada for business, for pleasure. And it would just basically make a scenario where we would re-import a lot of cases, as we saw before the border was closed. And it would essentially undo all the hard work that we've done to get our epidemic under control.
Dr. Deonandan, do you see it as being that dire? Because, I mean, at the moment, there is travel happening to and fro, certainly not tourist travel, but we see essential travel, truckers, for example, driving back and forth. I mean, what's at stake in your mind? And I suppose, what would you want to see before that border reopens?
I think that our focus should be 100% on finding a safe way to open schools in the fall. Anything that distracts us from that goal is ultimately a disservice to keeping our economy open. The best way to keep schools open safely in the fall is to have our caseload low in the community, in the single digits if we can. Opening up the border in no way serves that goal. In fact, in many ways, it introduces new seating events. Every American traveler that comes across that border is possibly the source of a new outbreak, and possibly, as Dr. Bogosh was saying, a small forest fire. I don't see this helping our long-term cause in any way, shape, or form. There's nothing good that can come of it, except for the travel of essential goods, as you mentioned, via truck drivers and so forth. Recreational travel might be economically interesting for a few, but the risk is far too great in my mind.
So if the potential risk then, Dr. Bogosh, as you put it, is the undoing of the progress that Canada has made so far in controlling the pandemic, I mean, what would you want to see in terms of, I don't know, either testing numbers or hospitalization numbers or death numbers in the United States, or even from a policy perspective? What is it that you would want to see before that border reopens?
Yeah, certainly it would be great to see some central leadership. And with good central leadership, both at the federal level and at the state level, we hopefully watch them get their epidemics under control. And there'd be a constellation of metrics, reduction in the number of new cases per day, a sustained reduction in the number of new cases per day, and public health policy that really facilitates that a low number of cases can be sustained. But until that happens, I think, for fans of Canadian football, we're just going to have to keep punting this decision month by month by month down the field and delaying the border from reopening, because quite frankly, even if they did everything perfectly today, it would still take months for them to get their epidemic under control there.
We'll have to see how it plays out. Doctors, thank you so much for this. I appreciate it.
My pleasure.